It's 2025. What do you need to know about Medicare as we start the new year? Well, here to talk with me about that is Jae Oh, author of Maximize Your Medicare. Jay, welcome.
Happy New Year to you, Bob. Thanks for having me.
Happy New Year to you as well. And I'll be even happier if you can sort of help us figure out what we need to know about Medicare as we start the new year.
Well, sure, Bob. During the first quarter of every new year, there's actually a new window. And that new window is a time where existing policy members of Medicare Advantage, so plan members of Medicare Advantage, you do have additional flexibility. First of those is the well-known one, which is that you can change Medicare Advantage plans once during this period, unless you're changing to a 5-star plan, in which case this ability to change amongst plans exists throughout the year. The other ones are a little less known, and I wrote in Jay's Corner, the newsletter, additional consumer tips. So if you're an existing Medicare Advantage member, very frequently there are enhanced benefits, which may include an additional premium. And what I encourage people to do, especially for Medicare Advantage, is to go to your provider as soon as possible. For example, a dentist to get x-rays, or to your primary care physician, where you may want to find out whether or not you've got your annual exam, just to reveal whether or not you reasonably can predict that you may need more services. For example, you find a dental issue. And the reason I say that is that these additional benefits can be very valuable from a financial point of view, which is usually there's a base embedded set of benefits. And those come at no additional charge. And even though there may be an additional charge for enhanced benefits, that these extra benefits can be very, very valuable, meaning that the benefit amount under dental, which is the most commonly misunderstood topic, can increase by many thousands of dollars, $2,000, $3,000 in a calendar year, on top of what already exists. And probably one of the most least publicized features of dental, especially inside of Medicare Advantage, is the fact that there's no waiting period. And so in addition to these higher benefit amounts, there's no wait, meaning you can have major dental services conducted without having this 6-month or 1 year waiting period, which can be enormous and save many thousands of dollars, as many people know.
Yeah.
So that is the first one. And it's a pretty big one, Bob. It's one that I don't think that people take full advantage of.
Yeah. So in the past, when we've talked about dental, hearing, vision, et cetera, that there's always been a cap on what they'll allow. But now you're saying that for an additional extra premium, you could exceed that cap.
That's right. What they do is they add to the benefit amounts. And like I said, the amounts are large, and very importantly, from a practical point of view, they're available at price points that I, as broker, cannot offer to people at that price, and certainly not at that price with no waiting period. So when you add it up, that this can be very valuable. It's so valuable, in fact, Bob, that because Medicare Advantage itself is so competitive, depending on your location, that the embedded extra dental and vision can be the reason that I suggest to our clients plan 1 versus plan 5 in a particular location. That can absolutely happen. In fact, it happened this morning.
Yeah. So as you think about people in this period of time, the January to March period, where they can change their Medicare Advantage plan, it's one to find out what the extra premium would be for these embedded services from your current plan provider, and then also look at it what it would be from your potential plan provider if you were to switch.
That's right, Bob. And that's why I'm glad we're speaking about this right here at the beginning of the year, because you don't have this unlimited time frame
Mm.
to add the enhanced benefit packages. So, for example, you do not get to call me up in October and say, can I have the enhanced package for November and December? The math of insurance does not work that way.
Yeah.
So there is a limited time frame in which you can add these extra packages. And that's why I suggest to people to go to your providers early in the year.
Yeah. So Jay, a similar question maybe, but for folks who have Medicare Advantage with a Part D plan as part of it, and for whom someone might be prescribed insulin that they thought was covered under the $35 a month program, and then they learn that perhaps that drug that their manufacturer isn't covered under their Part B plan, is it also wise for them to look at other MAPD plans where their insulin might be covered, or where their doctor could prescribe an insulin that would be covered under the $35 a month program?
What I would say here is that, as we spoke at the end of last year, that prescription drug coverage, prices, copays, the coverage has fragmented even further going into 2025, something that we've been discussing over in 2024. And that has come to actually occur, which did not require us to have a crystal ball. It
Yeah.
was simply that the Inflation Reduction Act and the drug negotiations has resulted in very complicated situation on what was already complicated to start. And so what I would say here is that absolutely, that if you get a surprise, you have a Medicare Advantage prescription drug plan, an MAPD plan where prescription drug benefits are embedded, that this can also be a reason. Certainly that is the case, I would say, depending on your overall cost, your household finances, because prescription drug costs can be the dominant over-the-counter cost, or out-of-pocket cost, I should have said,
Mm.
for healthcare reasons throughout a year. That is certainly the case.
Yeah. Anything else in general that folks need to think about as we talk about Medicare in 2025?
I think that's enough for today, Bob. There are certainly more, but we'll be able to get through them in the very near future. Certain changes have occurred. They will continue to change. The healthcare system is so complicated, and the fact is that 2025 will be another year of 11,000 people turning 65 every day.